Sleep disorders are incredibly common. And when I left training in psychiatry, I left in 77, but by the early 90s, I realized there were lots and lots of people that had sleep problems that I didn't know anything about. I never got any training in them. So I went to 3 consecutive national meetings in a row, 3 years in a row, South Carolina, and I learned a lot about sleep disorders. And I felt like I was now armed with enough information to really make a difference. It's one thing to treat somebody for depression, but if they couldn't sleep, you haven't done much for them, you know. And most of the drugs that were used for sleep were addictive, like Restless and drugs like that. They worked for a while, but they didn't work very well. And people ended up getting addicted to them. So I went to, what's the name of that place? Right outside. It's an island just outside of Charleston. It's Kiowa Island, Kiawah. And the director of the sleep disorders program in Georgia Medical School would hold these meetings over there. And they were held in August. It was really hot, but they gave us free golf because there was nobody there. This was a golfing island. They gave us free golf, got half price on the rooms, so it was an ideal thing for a psychiatrist. Psychiatrists aren't rich people, unfortunately. So I learned an awful lot there, and there are a whole bunch of sleep disorders, but there's about 3 or 4 that are by far the most common. And I'll just sketch those briefly. The most common one is restless leg syndrome. You move your limbs, feet, and legs, or maybe arms in bed, and you can't go to sleep. And most people think it's their mind won't stop running, but it's not really their mind. That's part of the syndrome, but it's due to neurons in the brainstem and spinal cord that are malfunctioning. And as I said, in genetics, all these disorders are genetically determined. You inherit a gene from your parents, and if you get that gene, you're going to have a sleep disorder. The restless leg syndrome is the most common. At least 10% of the general population has RLS. So that's about probably 20 million people. That's a lot of people. And there's another syndrome that is often seen with it called periodical disorder. It means your limbs move during your sleep. And when that happens, your sleep either goes up to an ineffective sleep stage or you wake up and you can't go back to sleep very easily. If you have that second one, you wake up in the morning with messed up covers because your limbs have been moving during your sleep. Those are the 2 most common. So those are about 20 million people. That's a lot of people. There's a lot of other what are called parasomnias, like REM, REM movement disorders. There's one where people sleep too much. It's called idiopathic hypersomnia. In other words, they sleep all the time, but they don't know what causes it. And these people start sleeping like this when they're like 12 years old, 13 years old. So by the time I see them, they've been doing this for their whole life. They don't realize there's something wrong with them. They just think I'm a sleepy person. So you won't, unless you specifically ask about it, you will never hear about it. And sometimes they'll make a casual comment and it triggers my interest. And it's amazing to treat these people because they respond. They wake up. It's like people were asleep their whole life. Like, I forget the name of the movie about some of these people. But that's a disorder of sleeping too much. So there's a lot of other sleep disorders also, but restless legs and periodic limb movement are by far the most common.